The Nuvant Mobile Cardiac Telemetry (MCT) system, developed by Corventis, is a technology designed to monitor your heart activity and help your physician diagnose any unusual rhythm of your heart. Once activated, the Nuvant MCT system will be able to detect and transmit medical data to the Corventis Monitoring Center. The data are reviewed by the Corventis Monitoring Center, and your physician is notified if an unusual heart rhythm is detected. The Nuvant MCT system is comprised of PICS, the adherent device, Z-Link, the data transmission device, and a patient trigger magnet to trigger an ECG when you feel symptoms. Inside the box, you will also find some literature explaining how the system works. Z-Link. Use the charger provided to charge the Z-Link. For certain geographies, a plug adapter may also be included. Insert the connector into the Z-Link. Plug the charger and adapter, if applicable, into an electrical outlet. Z-Link will begin charging immediately. If the lights on the Z-Link do not light up, push and hold the power button until the lights come on to turn on the Z-Link. During charging operations, the power light may flash between amber and blue, indicating that the battery charge is low. The Z-Link should be kept connected to the charger until the power light is blue. This may take up to 6 hours. PICS placement. Apply PICS to the left side of the chest, starting at the collarbone. Trim as much hair as possible from the intended location on the upper left chest. To trim the hair, it is recommended to use an electric razor or hair trimmer. Trim an area slightly larger than the PICS. Avoid using moisturizers in and around the area prior to application. Using the prep wipe, prepare the skin area where PICS will be placed and allow it to dry prior to PICS application. Remove PICS from the foil pouch by tearing at the notch. Take PICS out of the pouch. Place the PICS device face up on a table with the end showing Corventis pointed towards the right. Using your left hand, grasp the middle of the PICS, using your fingers to grab the sides of the raised portion of the PICS that is located just under the display. Turn it over to view the underside. Use your right hand to lift and pull the cover without the tab. Then, peel back and remove the second cover using the tab. For proper attachment, assure that there are no wrinkles and the edges do not fold in when applying. Bring the PICS close to your upper left chest, holding it as shown. Take care not to fold the fabric onto itself while you handle the PICS. Position the end with Corventis just below the collarbone and angle the device towards the nipple. To minimize skin irritation, do not place the PICS over broken or damaged skin. For female patients, it is important to position the PICS with the correct alignment, with the top half just below the collarbone and the lower half of the PICS covering the upper area of the breast. A bra can be worn over the PICS comfortably. Petite patients can angle the PICS slightly away from the nipple and towards the left arm for a comfortable fit. Once applied, press the entire PICS against your skin using the palm of your hand. Then, use your fingers to press the edges of the PICS onto your skin. Avoid strenuous motion, activity, or showering for 30 minutes after you apply the PICS. Take care to apply the PICS device as described. If it is applied incorrectly, you may be required to use another PICS. Immediately after applying PICS, a light behind the filled circle will appear. This light will blink during use. Check the PICS display for this symbol periodically, at least every 12 hours, to ensure that PICS is functioning properly. Now you are ready to continue with your normal daily activities. The PICS is water resistant. You may shower with the PICS, but do not submerge the PICS in water by swimming or sitting in a hot tub. Once applied, do not remove and then reapply or reposition the PICS device. If this happens, you may be required to use another PICS. How to use the patient trigger magnet. Carry your patient magnet with you at all times. Whenever you have symptoms such as lightheadedness, palpitations, blurred vision, or other similar sensations, use your patient trigger to capture an ECG, a reading of your heart activity at that point in time. To capture an ECG, swipe the patient trigger magnet along the entire length of PICS at a slow, uniform rate. This can be done by direct contact with the device or over light clothing. You may be contacted by Corventis to discuss symptoms when the patient trigger magnet is used. Z-Link should be within 30 feet, 9 meters of you at all times. At night, charge the Z-Link and keep it close to you while you sleep. The Z-Link should be kept on at all times to allow transmission of data from the PICS to the Z-Link. During the day, carry the Z-Link with you using the Z-Link holster. When the power light starts flashing blue and amber, it is necessary to recharge the Z-Link. Some patients ask about the other lights on the Z-Link. These are sometimes used by Corventis customer service, but otherwise can be ignored. When PICS reaches end of use, 2 lights behind the circle with crossed line symbols will appear, indicating it is necessary to remove your PICS. PICS removal. Remove PICS by peeling back the edge of the device by gently pushing the skin away from the device as it is removed. Peel the PICS slowly. Rapid removal can cause skin irritation. Please do not use lotions, body oil, etc. if placement of a new PICS is necessary. Once it has been removed, do not reapply the PICS as this might affect monitoring. In addition, wait until the end of the monitoring period before disposing of the PICS devices. This helps to ensure that all of your data are transmitted. Apply a new PICS if your prescription has not yet been completed. Returning Z-Link. Once your prescription has ended, return Z-Link, the Z-Link charger, and the patient trigger magnet per the instruction provided. Thank you for using the Nuvant Mobile Cardiac Telemetry System.